Get this, we're about to enter a vaccine revolution. Forget yearly flu shots, we're talking potential breakthroughs in cancer treatment and beyond.
It is incredible. The pace of innovation in this field is mind-boggling.
I know, we've got a stack of YouTube videos from top experts, and honestly, I'm a little giddy about diving in. They cover everything from the nitty-gritty of how mRNA vaccines work to wild possibilities like, get this, tobacco plants being used to produce COVID spike proteins for vaccines.
Remarkable how nature can be harnessed in unexpected ways.
Okay, before we get ahead of ourselves, let's rewind a bit. A lot of folks still aren't totally clear on how these mRNA vaccines work. Could you break it down for us?
Absolutely. It all boils down to how our cells make proteins. Our DNA contains the instructions, but it needs a messenger to carry those instructions out to the protein-building machinery in our cells. That messenger is mRNA.
So that's where the M comes in.
Precisely. And an mRNA vaccine essentially delivers a specific set of instructions to our cells, telling them to produce a harmless piece of a virus, like the spike protein in the case of COVID-19.
So it's like giving our cells a blueprint to build their own defense system.
A perfect analogy. And once our cells produce that viral protein, our immune system recognizes it as foreign and starts building up defenses.
Clever. But here's the thing. The videos mention that mRNA is super fragile. Didn't that make developing these vaccines incredibly challenging?
Oh, absolutely. For decades, scientists struggled to stabilize mRNA and deliver it effectively into cells. Imagine trying to transport a snowflake across a desert. That's how delicate it is.
Wow, that's a great image. So how do they finally crack the code?
Years of research and a few key breakthroughs. Two names you'll hear a lot in these videos are Catalin Carrico and Drew Weissman. They dedicated their careers to understanding mRNA and faced a ton of skepticism along the way.
It's always those under-the-radar folks who end up changing the world.
Indeed, one of their major hurdles was figuring out how to modify the mRNA to make it more stable and less likely to trigger an unwanted immune response. It was like finding the perfect disguise for a secret agent.
So they were essentially making the mRNA stealthier.
Precisely. And then there's the delivery system. Scientists discovered that encapsulating the mRNA in tiny protective bubbles called lipid nanoparticles was the key.
Lipid nanoparticles, those sound familiar.
They're essentially like microscopic delivery trucks that protect the mRNA and help it slip into our cells.
So that's how they overcome that snowflake in the desert problem.
Exactly. And without those breakthroughs, those warp speed COVID vaccine rollouts wouldn't have been possible.
I'm starting to see how all these pieces fit together. It wasn't just luck. It was years of dedicated research and some brilliant minds paving the way.
And speaking of brilliant minds, there's another key player you should know about, Barney Graham from the NIH. He wasn't even working on COVID when he made a discovery that proved crucial for these vaccines.
Now that's intriguing. Tell me more.
He was studying other coronaviruses and trying to understand why a failed RSV vaccine trial decades ago had actually made people sicker. His work led to a critical insight about the shape of viral proteins.
We have a vaccine that made people sicker? That sounds terrifying.
It was a major setback, but it taught us a crucial lesson. The shape of a protein matters just as much as its sequence when it comes to how our immune system responds.
So it's not just what a protein is made of, but how it's folded that determines its effect.
Exactly, and this understanding paved the way for a game-changing modification to the COVID spike protein's genetic code. It's called the 2-proline substitution.
Okay, 2-proline substitution, that sounds pretty technical.
It is, but think of it this way. It's like tweaking a key to perfectly fit a lock. By making this tiny change to the spike protein's code, they were able to lock it into a shape that made the vaccines much more effective at triggering an immune response.
That's a brilliant analogy. So this key tweak came from Graham's work on other coronaviruses.
Yes, and here's where it gets really exciting. Operation Warp Speed.
Ah, yes. The government's massive push to accelerate vaccine development. I remember those headlines.
Well, one of the reasons it was so successful was their decision to invest in a variety of different vaccine platforms, including mRNA. It was a smart move, not putting all their eggs in one basket.
It sounds like they were taking a calculated gamble on these new technologies.
They were, and it paid off big time. That early investment allowed scientists to move quickly and explore multiple avenues simultaneously.
So in a way, we have these past failures, unexpected discoveries, and some bold government funding to thank for those warp speed vaccines.
Absolutely. And what's even more remarkable is that these mRNA vaccines are just the tip of the iceberg. What we've seen with COVID is just a glimpse of what's possible.
Okay, now I'm really on the edge of my seat. Let's talk about what's next. Where is this vaccine revolution headed?
Well, imagine a future where we have a universal coronavirus vaccine, one shot that protects you from all current and future variants, no more scrambling to keep up with new mutations.
Now, that would be a game changer.
And then there's the storage issue. Right now, many vaccines, especially those using mRNA, need to be kept ultra cold. This can be a huge logistical nightmare.
Yeah, especially in parts of the world where maintaining that cold chain is incredibly difficult.
Exactly, but scientists are already working on improved storage solutions, vaccines that can be kept at room temperature. Imagine the possibilities if vaccines were as easy to transport and store as, say, a bottle of aspirin.
That would be incredible. What else is on the horizon?
Well, how about nasal vaccines? They'd be delivered with a sniff instead of a shot, and could offer better protection against transmission because they would mimic natural infection.
Intriguing. I'm also curious about flu vaccines. I feel like they're hit or miss each year.
With mRNA technology, we could see more accurate flu vaccines because the production timeline is much faster. Instead of months, we could potentially create flu vaccines tailored to the specific strains circulating each season.
So no more worrying about whether I got the right flu shot. Sign me up.
But here's where it gets really interesting. Scientists are exploring the potential for vaccines that target currently untreatable diseases like cancer, Alzheimer's, and Parkinson's.
Hold on. Vaccines that could potentially treat these diseases. That sounds almost too good to be true.
It's still early days, but the research is very promising. These therapeutic vaccines would train our immune systems to recognize and attack specific cancer cells or harmful proteins that build up in the brain.
So it's like turning our own bodies into weaponized healers.
Exactly. Companies like BioNTech and Moderna, who you already know from their COVID vaccines, are leading the charge in this area.
This is mind-blowing. We could be on the verge of a new era of medicine, where vaccines aren't just about preventing infectious diseases, but also about treating some of humanity's most challenging illnesses.
It's truly revolutionary, and if we think about the bigger picture, this could profoundly impact how we understand health and longevity. Imagine a world where regular vaccinations are a lifelong practice, helping us stay healthy and ward off disease well into old age.
That's a future I'd love to see. But there's a catch, isn't there? We can have all these amazing vaccines, but people refuse to take them. It's all for nothing.
You've hit on a critical point. The success of any vaccine relies on public trust and acceptance. Sadly, we're seeing a concerning rise in vaccine hesitancy and the spread of misinformation.
It's disheartening to see people reject life-saving vaccines based on unfounded fears and conspiracy theories. Why do you think this is happening?
Well, there's no single answer. One factor is the increasing distrust of experts and institutions, especially in the echo chambers of social media.
Right. It's become difficult to separate fact from fiction, and unfortunately, some folks seem to prefer engaging with sources that reinforce their existing beliefs, even if those beliefs aren't based on evidence.
And this ties into a broader societal trend. The rise of flattened truth and relativism. There's a growing idea that everyone's opinion is equally valid regardless of evidence.
It's like we're living in a world where facts are negotiable, and that's a dangerous path.
Absolutely. And this tendency to misinterpret correlation as causation also fuels vaccine fears. Just because two events happen around the same time doesn't mean one caused the other.
That's so true. Like, just because some children develop autism around the same time they receive vaccines doesn't mean the vaccines cause the autism.
Exactly. And one of the experts featured in these videos, Amesha Dalja, an infectious disease doctor, talks about the immense frustration of seeing preventable deaths due to this misinformation. He even mentioned receiving death threats for simply advocating for vaccines.
It's appalling that healthcare professionals are being targeted for trying to save lives. What about specific concerns people have, like potential side effects?
It's important to address those concerns head-on. One that comes up often is the risk of myocarditis, inflammation of the heart muscle in young men after getting mRNA vaccines.
I've heard about that. How serious is it?
The good news is that cases following vaccination are typically mild, temporary, and don't seem to cause long-term damage.
That's reassuring. But what about this idea that the Vaccine Adverse Event Reporting System, VAER, is being suppressed or manipulated?
VARs. It's a valuable tool, but it's often misunderstood. Anyone can report anything to VARs, even if it's not actually related to the vaccine. It's like a giant suggestion box where people can write down anything they experience after getting vaccinated, whether it's a headache, a stubbed toe, or a bad dream.
So it's not necessarily a reliable source of information about actual vaccine side effects.
Exactly. It's a starting point for further investigation, not a definitive list of proven side effects. Scientists and public health officials use VAR's data to look for patterns and potential signals of rare side effects. If they see something concerning, they investigate it thoroughly using rigorous scientific methods.
So don't jump to conclusions based on something you read on VARs. Leave it to the experts.
Precisely. It's also important to remember that the benefits of vaccination far outweigh the risks for the vast majority of people.
What about pregnant women or people with autoimmune conditions?
Those are important considerations, and it's always best to consult with your healthcare provider to make an informed decision. But the data we have so far suggests that COVID vaccines are safe and effective for pregnant women and don't seem to pose additional risks for individuals with autoimmune conditions.
So it's all about weighing the potential risks and benefits on an individual basis.
Exactly. Good communication from trusted healthcare providers is crucial in helping people make those decisions.
What about the role of government agencies like the FDA and CDC? What are they doing to address vaccine hesitancy and communicate effectively with the public?
They're working hard to provide accurate information and combat misinformation, but it's a constant uphill battle. As Amesh Adalja pointed out, they sometimes struggle to find the right balance between giving clear and concise guidance while acknowledging that each person's situation is unique.
It's like walking a tightrope, isn't it? They need to simplify the message for the general public, but also avoid a one-size-fits-all approach that might not address everyone's concerns.
That's exactly the challenge they face. And to make things even more complex, the science is constantly evolving and the virus keeps throwing us curveballs.
So we've got scientific advancements, changing societal trends, and the complexities of human psychology all intertwined. It's a lot to unravel.
And this brings us to another game changer in the vaccine world: artificial intelligence.
AI. I'm curious how AI fits into this vaccine revolution.
Oh, it's going to play a huge role. Imagine AI algorithms that can analyze massive amounts of data to identify potential vaccine targets, doing in a matter of months what would take us years to achieve with traditional research methods.
That's mind-blowing. Could we potentially develop vaccines in a fraction of the time?
Potentially, yes. AI can also help us optimize vaccine design, making them even more effective and safer.
Incredible. What else can AI do in this field?
How about personalized vaccine recommendations? Imagine a future where your doctor can use AI to analyze your medical records, genomic information, and even data from your wearable tech to recommend a vaccination schedule that's perfectly tailored to your individual needs.
Wow, so instead of a one-size-fits-all approach, we could have vaccines that are personalized to our specific health profiles.
You got it. It's like having a personal vaccine concierge who knows exactly what you need. And one of the videos features William Falcon, the CEO of Grid AI. He's incredibly optimistic about AI's potential to revolutionize medicine and paints a vivid picture of a future where AI-powered vaccine development is the norm.
I love how he compares this to the moon landing. It was a massive collaborative effort involving thousands of companies and individuals, and he believes AI can play a similar role in coordinating the complex process of vaccine development.
It's a powerful analogy. It highlights how crucial collaboration is in tackling these enormous challenges.
So AI isn't about replacing human scientists, right, but giving them the tools to work faster and smarter.
Precisely. It's about combining the best of human ingenuity with the raw processing power of AI.
You know, as we delve deeper into this vaccine revolution, there's one aspect that's particularly captivating: the potential for personalized vaccines.
It is a fascinating concept, moving away from a one-size-fits-all approach to something tailored specifically to each individual's needs.
It sounds like something straight out of science fiction. Yeah. Can you paint a clearer picture of what this might actually look like?
Imagine a world where your vaccine isn't just based on your age or a general risk profile, but is crafted based on your unique genetic makeup, medical history, and even lifestyle factors.
Wow, that's incredible. But how would that even be possible? It sounds incredibly complex.
That's where the power of AI comes in. Remember how we talked about AI's ability to analyze massive amounts of data? Well, picture algorithms that can sift through your medical records, genomic information, even data from wearable technology to design a vaccine that's perfectly optimized for you.
It's like having a custom-designed immune system booster shot, tailored just for me. That's mind-blowing.
And it could be revolutionary for people with compromised immune systems, allergies, or specific genetic predispositions. We could create vaccines that are both safer and more effective for individuals who don't respond well to traditional vaccines.
So it's not just about preventing diseases we already vaccinate for. It's about opening up a whole new world of possibilities for people who haven't had these options before.
Precisely, and it goes beyond just prevention. We
Hmm.
could see personalized vaccines that treat existing conditions like cancer or autoimmune disorders. Imagine your own immune system being trained to target and eliminate specific cancer cells or rogue molecules causing your illness.
Instead of chemotherapy or harsh immunosuppressants, it's a targeted strike force designed specifically for your body. It's almost like having a personalized vaccine chef whipping up the perfect immune-boosting recipe just for you.
That's a great analogy, and that's where the line between traditional vaccines and therapeutic treatments starts to blur. We're talking about a whole new category of medicine.
Okay, I can see why you're so excited about this, but
Yeah.
let's be realistic for a moment. We can't just snap our fingers and make this happen overnight, right?
Of course not. There are some major hurdles we need to overcome. First and foremost, the cost, personalized anything, usually comes with a hefty price tag. How do we ensure that everyone can benefit from these advancements, not just the wealthy?
That's a crucial point. It would be a huge step backward if this amazing technology only benefited a privileged few.
Exactly. It will require a concerted effort from governments, research institutions, and pharmaceutical companies to find ways to make these treatments affordable and accessible to everyone.
So as with many groundbreaking innovations, it comes down to more than just the science. It's about navigating the complex world of economics and policy as well.
Absolutely. And we can't forget about the regulatory landscape. These personalized vaccines would be a completely new type of medicine, and regulatory agencies would need to adapt their frameworks to ensure safety and efficacy while encouraging innovation.
We need to strike a balance between progress and caution. We can't afford to stifle innovation, but we also can't cut corners when it comes to safety.
You're right. And then, of course, there are the ethical considerations we've touched on before. Data privacy and algorithmic bias become even more crucial when we're dealing with such sensitive personal information.
We need to make sure these powerful tools are used responsibly and for the benefit of all, not just a select few. It's a huge responsibility.
It is. It's about finding that sweet spot where scientific progress aligns with ethical principles and social justice.
It's fascinating how this conversation keeps circling back to the importance of open dialogue and public engagement. We can't just leave these decisions to scientists and policymakers. Everyone needs to be part of this conversation.
I couldn't agree more. This isn't just about technology. It's about how we as a society choose to use this technology to shape our future. Speaking of the people involved, I'm constantly amazed by the brilliant minds behind these breakthroughs.
You know, watching those videos, I was struck by the sheer passion and dedication of these scientists. They're not just lab coat-wearing geniuses. They're real people driven by a deep desire to make a difference in the world.
They see the immense potential of these vaccines to alleviate suffering and transform healthcare, and they're willing to dedicate their lives to making that vision a reality. It's incredibly inspiring.
It reminds me that science isn't just about cold, hard facts. It's a human endeavor fueled by curiosity, compassion, and a desire to make the world a better place.
Beautifully said. And these scientists aren't working in isolation. They're collaborating with engineers, entrepreneurs, policymakers, and healthcare providers to bring these groundbreaking technologies to the masses.
It's a true testament to the power of human collaboration. And it makes you wonder, what are the broader economic implications of this vaccine revolution? It's not just about individual health. It could impact entire industries and economies.
You're right. The potential economic impact is enormous. Not only could these vaccines save billions of dollars in healthcare costs by preventing and treating diseases, but they could also create entirely new industries and job opportunities. Think about the research, development, manufacturing, and distribution of these new treatments. It's a whole new economic ecosystem.
That's exciting. And what about the potential to bridge the gap between wealthy and developing nations? Could these advancements help address global health inequities?
That's certainly the hope. One of the most promising aspects of this technology is its potential to make vaccines more accessible and affordable for everyone, regardless of where they live.
We talked about the challenges of cold storage earlier. Imagine if we could develop vaccines that are stable at room temperature and can be easily transported to even the most remote corners of the world.
It would be a game changer for global health, allowing us to reach populations that have historically been underserved by traditional vaccination programs. And it's not just about infectious diseases. We could potentially address chronic illnesses that disproportionately affect people in low-income countries as well.
It's a powerful vision of a future where everyone, everywhere, has access to the life-changing power of vaccines. But let's be realistic. There are bound to be challenges along the way. Developing and distributing new vaccines, especially personalized ones, will be a complex undertaking.
Of course, there will be scientific hurdles, regulatory roadblocks, manufacturing challenges, and unexpected ethical dilemmas. We've already witnessed some of these complexities with the COVID-19 vaccine rollout.
It's a reminder that progress isn't always linear. It's often messy and unpredictable, with setbacks and unexpected twists along the way.
That's the nature of scientific discovery. It's a process of trial and error, pushing the boundaries of what's possible and learning from our mistakes.
And it requires a willingness to adapt and evolve as new information emerges. We can't be rigid in our thinking. We need to be flexible and open to new ideas.
Exactly. And we need to be patient. These breakthroughs won't happen overnight. It takes time to translate scientific discoveries into real-world solutions.
That's an important point. It's easy to get swept up in the excitement of these possibilities and forget that real progress takes time, persistence, and a lot of hard work.
But with the right combination of scientific ingenuity, public support, and careful planning, I'm confident that we can overcome these challenges and unlock the full potential of this vaccine revolution.
This conversation has been incredibly enlightening. I'm both excited and a little overwhelmed by the sheer scale of what we've discussed. It feels like we're on the cusp of a truly transformative era in medicine and human health.
It's an exciting time to be alive, wouldn't you say? And there's still so much more to explore. In the next part of our deep dive, we'll delve into a somewhat controversial topic that often sparks debate: the role of human infection studies in vaccine development.
Okay, now that's something I definitely want to hear more about. It's a topic that raises important ethical questions, and I'm curious to get your perspective. Listeners, stay tuned for the final part of our deep dive. We'll be right back after a short break. Welcome back. Before the break, we were about to dive into a topic that often sparks debate: human infection studies. What exactly are they, and why are they important for vaccine development?
Well, human infection studies are controlled studies where healthy volunteers are intentionally exposed to a pathogen, a virus, or bacteria in a safe and carefully monitored environment.
You know, when you put it that way, it sounds a little intense. It's not something most people would volunteer for, I imagine.
It's certainly not for everyone, but it can be incredibly valuable for understanding how diseases spread and how our bodies fight them off.
I can see how that would be helpful for researchers. But why would someone willingly expose themselves to a disease?
There are a few reasons. Some people are driven by altruism. They want to contribute to scientific advancement and potentially help save lives.
That's pretty selfless.
It is, and of course, participants are compensated for their time and the risks involved. But beyond that, these studies offer us insights that are difficult or impossible to gain through other research methods.
Okay, I'm intrigued. Can you give me an example?
Let's say we're trying to develop a vaccine for a disease that's extremely rare or only found in remote parts of the world. It would be difficult to conduct a large-scale trial because it would be hard to find enough people who've been naturally exposed to the disease.
That makes sense.
Yeah.
So a human infection study allows researchers to create a controlled environment where they can study the disease and how our immune systems respond.
Exactly. It's like fast-forwarding the research process. Instead of waiting years for a vaccine to be tested in the real world, we can gather crucial data much more quickly.
So it's about accelerating the development timeline and potentially getting life-saving vaccines to people sooner.
That's one of the major benefits, and because we can closely monitor the participants, we can also study how different vaccine candidates perform and identify potential side effects early on.
I see how that could be incredibly helpful, especially when we're dealing with a new or rapidly evolving virus. But let's be honest, there are risks involved, right?
Of course, there's always a chance that a participant could experience serious side effects, even with the best medical care. That's why these studies are only conducted with strict safety protocols in place, and participants are carefully screened to minimize potential risks.
I imagine the ethical considerations are quite complex as well.
You're absolutely right. It's a delicate balance. We have to weigh the potential benefits for society against the risks to individual participants. Transparency is crucial, and it's important to involve the public in these discussions. People need to be informed about how these studies work and have a voice in shaping the ethical guidelines that govern them.
I agree. Open and honest communication is essential to build trust and ensure these studies are conducted ethically. It's a reminder that scientific progress isn't just about breakthroughs in the lab. It's also about having thoughtful conversations about the implications of those breakthroughs.
Well said. As we wrap up this deep dive into the future of vaccines, I'm struck by the incredible potential, but also the responsibility that comes with these advancements.
It's been a whirlwind of information. We've covered everything from the intricate workings of mRNA vaccines to the mind-boggling possibilities of AI-driven personalized medicine, and we've touched on the ethical challenges and societal implications woven into this tapestry of scientific progress.
We've only scratched the surface, really, but hopefully this conversation has sparked your curiosity and given you a glimpse into the future of this transformative field.
For me, it's underlined how important it is to stay informed, ask questions, and engage in these conversations, even if they're complex or controversial. After all, the future of vaccines isn't just about science, it's about the choices we make as individuals and as a global society.
I couldn't agree more. The future is something we create together, and informed citizens are essential in navigating the ethical landscape of scientific innovation.
So what can our listeners do to stay engaged with this evolving field?
Stay curious, keep learning about these advancements, read articles, listen to podcasts, and follow reputable scientific organizations. Don't be afraid to ask questions and challenge assumptions.
And remember that the future of vaccines isn't predetermined. It's something we all have a stake in shaping.
Well said. And with that, we've reached the end of our deep dive. We hope you found it both enlightening and inspiring. Thank you for joining us.